Module overview to equip you with advanced knowledge, technical proficiency, and regulatory standard skills necessary to perform safe, accurate, and patient-centered venipuncture using a variety of methods and tools under different clinical conditions. This includes understanding vein anatomy, selecting appropriate equipment, mastering various techniques, straight needle, butterfly, syringe, following procedural steps meticulously, and ensuring best practices for safety and quality assurance. 6.1 Understanding vein anatomy and vascular physiology. Effective venipuncture requires intimate knowledge of the vascular system, especially primary veins for phlebotomy, median cubital vein, most preferred, large, stable, low risk, cephalic vein, more lateral, deeper, often used in obese patients, basilic vein, medial, near brachial artery and nerve, use with caution, dorsal hand veins, used when arm veins are not accessible, foot veins, last resort, require physician approval due to infection risk, vein assessment, palpation, assess for resilience, bounce and direction. Visibility, not always indicative of accessibility, use touch, not just sight. Depth, superficial veins are safer, avoid veins overlying arteries. Understanding patient variability is vital. Hydration status, obesity, age, and mobility affect vein quality and access. 6.2 Selection of venipuncture equipment. Key equipment: needles 21 to 23 gauge, straight or butterfly, winged infusion set, vacutainer holder and tubes, match with test type, e.g. Editia for CBC, syringe set, used when vacuum pressure might collapse the vein. Tourniquet should not be left on longer than 1 minute. Alcohol prep pads, 70% isopropyl or chlorhexidine for special cases. Gloves, non-sterile, single-use, latex-free preferred sharps container for immediate disposal of used needles. Labeling tools, pre-printed barcoded labels or manual ones, label immediately after collection in patient's presence. 6.3 Standard venipuncture procedure, evacuated tube system method. Patient preparation. Confirm identity using 2 identifiers. Explain procedure clearly and obtain consent. Position patient comfortably. Apply tourniquet and identify vein site. Cleaning clean area with 70% alcohol using concentric circles. Let it air dry completely. Needle insertion. Anchor vein with thumb below puncture site. Insert needle bevel up at 15 to 30 degrees. Push collection tube into holder without moving needle. Blood collection. Use the correct order of draw. Blood culture bottles, light blue, citrate, red, no additive, gold, tiger top, SST, green, heparin, lavender, edite, gray, fluoride, oxalate, needle withdrawal, and post-care remove tourniquet when final tube is filling. Withdraw needle swiftly and safely. Apply gauze immediately with pressure. Do not bend arm. Discard needle in sharps container. Tube inversion. Gently invert tubes with additives 5 to 10 times. Do not shake. 6.4 Syringe and butterfly techniques. Syringe technique, ideal for small veins and pediatric or geriatric patients. Use slow, steady aspiration to prevent hemolysis. Transfer to tubes using transfer device to prevent exposure. Butterfly technique, used for hand veins or fragile veins, allows more control but is costlier. Increases risk of hemolysis if not handled gently. 6.5 Precautions and common errors to avoid. Do not leave tourniquet on for more than 1 minute, may cause hemoconcentration. Touch the site after cleaning. Shake tubes violently, causes hemolysis. Label tubes away from the patient. Attempt more than 2 venipuncture attempts without consulting supervisor. Common errors. Incomplete filling of tubes. Incorrect tube sequence affects test accuracy. Needle through the vein causes failed collection or hematoma. Drawing blood from an IV arm. Improper needle angle. 6.6 Emergency responses during venipuncture. Phlebotomists must be prepared to handle complications, syncope, stop procedure, lay patient down, elevate feet, monitor vitals, hematoma, apply pressure, ice if needed, seizure, protect patient from harm, call emergency team, needle stick injury, follow institutional PP protocol immediately, excessive bleeding, apply prolonged pressure, notify medical team. Module 6, Learning Outcomes. By the end of this module, you will be able to demonstrate mastery of venipuncture techniques using various tools, identify and select appropriate veins and equipment for each patient type, execute blood collection using best practice procedures, recognize and prevent common procedural errors, manage complications, and perform emergency interventions. Adhere strictly to aseptic, labeling, and documentation protocols. Align practices with accreditation standards from CLSI, CDC, OSHA, and WHO.